A new federal strategic plan aims to reduce American homelessness by 25% in 2025. Jeff Olivet is the executive director of the U.S. Interagency Council on Homelessness, which led the development of this plan. Jeff, welcome to the program.
Mimi, it's great to be with you.
This agency was created 35 years ago, but homelessness is still a major problem in the United States. Why hasn't the agency solved it by now?
You're right. Homelessness is a life and death public health crisis in this country, and it's been part of the American landscape for more than 3 decades now. There have been some things that are working, but I think one problem is we haven't fully scaled up the solutions that we know that work. We also have not, as a nation, done a great job preventing homelessness before it ever happens.
So what are those challenges? You talked about scaling solutions. What's really the barriers to really addressing this problem once and for all?
There's some underlying economic factors that are really important for us to understand and talk about. The increasing cost of housing, the fact that we don't have enough affordable housing in this country. In fact, in 1970, we had a surplus of 300,000 units of affordable housing. Now we have a deficit of 7 million. So when you see that trajectory of the loss of affordable housing, you can track that to a rise in homelessness over the last several decades.
Why that dramatic decrease in affordable housing? Where have they been going?
A lot have just cycled off the market. I think we've not also done a great job at developing a pipeline of affordable housing. There's a new effort led by the White House around affordable housing supply, trying to really speed along the development of that housing. The other issue is that wages don't always keep up with the cost of housing. So people simply don't make enough money, even if they're working 1 or more jobs. Many people are working 2 jobs and can't afford housing.
There has been a recent increase in homelessness in America over the past few years. What's behind that?
Well, we saw a downward trend from about 2010 to 2016, and then that curve started bending back upward. And I think some of the economic factors that I talked about are very real for people. I think the uncertainty of the pandemic and the economic situation has complicated that. Although by 2020, we started infusing resources through the CARES Act and the American Rescue Plan that have really begun to bend the curve back. So the last 2 years, we've seen a basic flat line where homelessness is no longer on the increase. It has kind of stayed steady. That's not good enough. We need to drive it back down again.
How does your agency fit into the broader federal effort to address homelessness? You know, there's HUD is obviously doing this, the VA. What's your specific role, and how do we know that there isn't a lot of duplication of effort?
One of our main jobs is to make sure that there's not duplication of effort. We bring together 19 federal agencies, including HUD, the VA, Health and Human Services, Labor, Transportation, and many, many others, to make sure that the effort is coordinated, pointing in a strategic direction, and as effective and efficient as possible.
You know, one element of the plan discusses what you had talked about, which is the lack of affordable housing. How does the plan address that? What are the solutions?
One thing I mentioned earlier is the White House Affordable Housing Action Supply Plan, which is really trying to create incentives for affordable housing development, creative financing mechanisms. So that's a piece of it. But we also need to shore up our behavioral health systems around mental health and substance use treatment, and we need to go upstream and turn off the faucet so that people aren't becoming homeless in the first place.
I also want to ask about, you know, once they do get into housing, is there programs in place to make sure that they don't fall back into homelessness again?
There are some very good programs that are providing case management and job training and mental health and substance use treatment, recovery from trauma and domestic violence and human trafficking. We just don't have those programs on a large enough scale to meet the demand. So one challenge is the affordable housing supply part. The other is how we scale up the wraparound support so that people really do stay successfully stable in housing.
You talked about coordinating and working with other federal agencies. I wonder if you work on the state and local level and with nonprofits or charitable organizations.
We do. In fact, I believe that the federal government has a strong role to play in allocating resources and in charting a direction, but the real work happens at the local level. It is the nonprofits, it's mayors and governors and local leaders who are really doing the work of ending homelessness. Our agency has a wonderful team of senior regional advisors who work in communities around the country. I meet routinely with governors and mayors, with local nonprofit leaders, and with folks experiencing homelessness to make sure that we're all pointing our efforts in the same direction.
You know, there have been plans like this in the past. This isn't the first one. What's fundamentally different this time, and why do you think that this time it's going to succeed?
What we're trying to do is build on the best things about the previous plans, and there have been some very good things. In fact, the first federal strategic plan to prevent and end homelessness was called Opening Doors more than a decade ago. That plan laid the groundwork for real success in reducing veteran homelessness, youth homelessness, family homelessness, and we've seen those numbers with those subgroups go down pretty significantly because of those plans. We're trying to take that work forward, but also chart new directions. One of the major new directions we're going is around prevention. So we've seen over the last few years hundreds of thousands of people, even millions of people, exit homelessness. It works. Like, a lot of the good housing and supportive services programs work, but we've not done a great job at closing the front door. So one thing that this plan is trying to bring to the table is a real focus on upstream prevention.
All right, well, Jeff, we certainly hope that you succeed, and good luck, and thanks very much for being on the program.
Thank you, Mimi.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.